Knock, knock. How are you today? Good. All right, my name is Sarah. I am going to be your nurse today. First thing, whenever I walk in the room, I'm going to wash my hands. I'm going to check to see that the bed's in the lowest position, which it is. You have your mom and dad with you. You have 2 side rails up. Correct names on the board. There's no chest tubes. There's no abdominal tubes. You're not on any oxygen at the moment. No trach. There is, let's see, no Foley catheter, no IV yet, and there's no clutter in any kind of pathway. So, what we're going to start with is, what brought you in today, Miss Matthews? I heard that you fainted at school today, is that right? Okay. And your mom and dad have said that you've lost some weight recently. Okay. So we're going to go ahead and do a quick head-to-toe assessment on you. Can you tell me your name? Say, Miss Matthews.
Miss Matthews.
Okay. And how old are you?
16.
Okay. Do you know where you're at right now?
No.
Okay. Go ahead. Can you sit up for me? Good job. Alright. Can you smile? Good. Can you look? I have a pen light. Can you look? Good. Good. Pupils dilate equally and they're nice and round. Next I'm going to listen to your heart. Okay? Good. S1 and S2 are present. Take a big breath each time. There you go. Good job. Hold on. Dr. Maverick was trying to get my attention. Good. Arm up for me. This side. Good job. Wait. Okay, hold on. You can come in here. You can come in here if you want. Okay. Hold on. When's the last time you had a bowel movement? Today. Okay. Are you having any pain in your belly anywhere? No. Okay, can I take a look? Alright, I'm just gonna listen to your belly. Relax. Is it cold?
Yeah.
Yeah. Does it tickle? Okay, active bowel sounds in all 4 quadrants. Can I touch your belly? Okay. Does that hurt? No, okay. Good. Okay. Now, I'm gonna have you sit up just a little bit, okay? There you go. Can you turn your head this way? Good. Other way? Good. Okay, no JVDs present. Okay, go ahead. Wait, go ahead. Can you grab my hands? Okay, squeeze. Good. Pull. Pull it again. Pull towards you. There you go. Push against you. Good. Okay. Check your cap refills. Everything is nice in return. No swelling is present on the top. No swelling in your ankles. Are you having any tingly feeling, like your foot's asleep? No? Okay. Good. Which toe am I touching? Good. Which toe am I touching over here? Good. Okay, I'm gonna wash my hands. We're going to get a set of vitals on you right now. I'm gonna also do a blood sugar check to see if we can get your blood sugar, okay? Because in the ambulance it said that it was at meter max, so it must be pretty high right now. So here's your blood pressure cuff, okay? Your pulse ox for your finger, under the tongue for your temperature, good. And just hang tight there for a couple of seconds. I'm gonna breathe nice and normal. I'm just gonna count your respirations. Okay. All right. Now I'm gonna go check some orders really quick, and I'll be right back in. Okay. Okay. You just hang tight. Here's your call light. Okay. Mom and Dad, I'll be back in a couple minutes. I'll be done in just a couple minutes, okay? Okay, knock knock. Wash my hands. Okay, so I'm looking at some labs right now. Mom and Dad, has anybody in the family ever had diabetes? Or no, nobody's had diabetes that you know of. Has she ever been diagnosed with diabetes in the past? No. Okay. Because I see that you've also lost some weight recently, and with all of your signs and symptoms, it seems that the physician feels that it may be diabetes. So, and also we've noted they're called Kussmaul respirations, and it's a breathing pattern that tends to happen whenever you're sick with something that is caused by diabetes. Does that make sense? Yeah. Okay. So, Mom, you're wondering why, since she's a nice, healthy, active, young adult, that she could get diabetes. Well, there's a lot of familial predisposition to it, and also the change in hormones can sometimes bring it on. So we'll get Miss Matthews taken care of. We're going to go ahead and do some lab work. We're going to get some blood sugar, glucose level on our BMP panel, which is just through a lab draw. Hemoglobin, we're going to get your A1C checked. We're going to do ABGs to check your metabolic panel. And then we will have you pee in a cup. We're going to check your urine for some ketones, okay? So it won't hurt too much, but we will need to draw some blood, okay? Do you understand? Yeah, okay. All right, so we're going to go ahead and do that, and then I will come back in after the nurse, or after the lab comes up and draws your blood, okay? Okay. Okay, knock knock. Me again. Wash my hands. Alright, so what we're going to do is we're going to go ahead and start an IV, get some fluids reintroduced back to you. Okay? And then we will start treating your diabetic ketoacidosis, which is what you have going on right now. Okay? So we will get it taken care of. We're going to start you on IV fluids, and then we will start you on some insulin to help with that. Does that make sense? Okay, so let's go ahead. So your IV is going to be in this arm, and then you're going to have another IV in this arm, just for safe measure, okay? So we're going to have normal saline running, and then we're also going to have an insulin drip on this one. Okay. I'm going to check your I'm going to check your blood sugar every couple hours to be sure that it's coming down and that it's within therapeutic range. Once your blood sugar drops below 250, we're going to switch you over to a different kind of fluid. Okay? All right. I'm going to report off to my friend. This is Nurse Becky, and she is going to be taking over for the next couple hours, okay? So Nurse Becky, this is Miss Matthews. She came into the emergency room after fainting at school. Before she came here, she's lost some weight recently. I need to sneeze. Excuse me. So I'm sorry, Miss Becky. So Miss Matthews came into the emergency room, fainted at school. She's been losing weight unintentionally. She's came in with presenting with Kussmaul respirations and a fruity breath smell. No history of diabetes whatsoever, but she did get diagnosed with diabetes. Her most recent blood sugar was 164, and I did do some education as far as insulin and how to inject, and she did demo that correctly, so I think that we're set on that. Vital signs were last current vital signs were within normal range. Mom and Dad are at the bedside, and the provider thinks that she should be able to go home today. Okay? All right. Miss Matthews, if you have any other questions, you just let us know, okay? Okay. Mom and Dad, thank you so much.